When assisting a patient with limited mobility to stand up from a chair, the CNA should first A. Pull the patient up quickly. B. Ensure the patient's feet are flat on the floor. C. Position the wheelchair directly in front. D. Place the gait belt on the patient after standing. Answer: B. Safety begins with ensuring the patient's feet are flat on the floor to provide a stable base before attempting to stand. A CNA notices a confused resident trying to leave the facility at night. The best first action is to A. Reorient the resident calmly. B. Call security immediately. C. Lock all doors to prevent leaving. D. Physically block the resident. Answer: A. Reorienting and calming the resident ensures safety without confrontation or violation of rights. Which of the following is the best way for a CNA to promote dignity during perineal care? A. Close doors and drape the resident. B. Complete the task quickly without explanation. C. Use only cold water to minimize discomfort. D. Ask another staff member to watch. Answer: A. Privacy through draping and closing doors protects dignity and prevents embarrassment. When taking an apical pulse, the CNA places the stethoscope over A. The radial artery. B. The left side of the chest at the fifth intercostal space. C. The carotid artery. D. The right side of the sternum. Answer: B. The apical pulse is taken at the apex of the heart, left fifth intercostal space, midclavicular line. A resident with dysphagia should be offered foods that are A. Dry and crunchy. B. Raw and fibrous. C. Spicy and strong flavored. D. Soft or pureed. Answer: D. Dysphagia patients require pureed or soft foods to reduce choking risk. If a CNA accidentally touches the inside of a sterile glove before putting it on, the glove is considered A. Still usable if only briefly touched. B. Acceptable only if the patient is stable. C. Safe if the CNA washes hands again. D. Still usable if only briefly touched. Answer: D. Any contamination of sterile gloves requires replacement to maintain infection control. A CNA notices red areas on a bedridden patient's heels. The most important action is to A. Massage the area to restore circulation. B. Place pillows under the calves to float the heels. C. Apply lotion and leave heels uncovered. D. Ignore unless the skin breaks. Answer: B. Elevating heels prevents pressure and reduces risk of pressure ulcers. Which statement about restraints is correct for a CNA? A. CNAs may apply restraints if the resident is agitated. B. Restraints can be applied without documentation. C. Restraints are used for staff convenience. D. Restraints require a physician's order. Answer: D. Restraints can only be applied with a physician's order, never for staff convenience. The CNA's role in pain management includes A. Administering narcotics. B. Reporting observed pain signs to the nurse. C. Adjusting medication doses. D. Ignoring if the patient does not complain verbally. Answer: B. CNAs cannot give meds but must report pain symptoms to licensed staff. While feeding a resident who has one-sided weakness after a stroke, the CNA should A. Place food on the unaffected side of the mouth. B. Place food on the affected side of the mouth. C. Feed quickly to avoid aspiration. D. Avoid offering liquids. Answer: A. Placing food on the strong side allows safer chewing and swallowing. A CNA sees a spill on the hallway floor. The best immediate response is to A. Tell housekeeping later. B. Stand guard until someone else comes. C. Clean the spill or mark it with a caution sign. D. Ignore it if small. Answer, C. Immediate action prevents falls and ensures safety. The correct action for a CNA during fire emergency is to use RACE. The R stands for A. Rescue. B. Report. C. Respond. D. Remove fire. Answer, A. RACE equals rescue, alarm, contain, extinguish. First priority is rescuing residents in danger. If a resident refuses their meal, the CNA should A. Insist they eat immediately. B. Replace with sweets to encourage eating. C. Document and report refusal. D. Ignore since appetite varies. Answer, C. Reporting refusal ensures dietary and medical needs are addressed. The best position for a resident with shortness of breath is A. Supine with head flat. B. Prone position. C. Fowlers or semi-fowlers. D. Trendelenburg. Answer, C. Fowlers helps expand lungs and ease breathing. The safest way to identify a resident before giving care is by A. Asking them their name only. B. Checking the identification wristband. C. Asking another staff member. D. Looking at room assignment. Answer, B. ID wristband is the most accurate and required method. When making an occupied bed, the CNA should A. Raise side rails for safety. B. Ask the resident to stand up. C. Remove linens all at once. D. Keep the bed flat. Answer, A. Safety is maintained by raising rails when resident turns. If a resident is incontinent, the CNA should A. Limit fluids to prevent accidents. B. Provide regular toileting schedule. C. Avoid changing briefs until wetness is visible. D. Punish the resident for soiling. Answer, B. Scheduled toileting promotes dignity and reduces accidents. When documenting care, the CNA must A. Record facts, not personal opinions. B. Use only pencil for corrections. C. Leave blank spaces for nurses. D. Erase errors completely. Answer, A. Documentation must be factual, objective, and accurate. If a CNA suspects elder abuse, the first responsibility is to A. Confront the suspected abuser. B. Ask the resident to stay quiet. C. Wait for more evidence. D. Report immediately to the nurse. Answer, D. Suspected abuse must be reported immediately to the nurse. To prevent aspiration during feeding, the CNA should A. Feed the resident while lying flat. B. Provide food quickly. C. Offer large bites. D. Ensure the resident is upright at 90 degrees. Answer, D. Sitting upright reduces risk of food entering airway. A CNA notes cloudy urine with foul odor in a resident's catheter bag. The correct action is to A. Empty and ignore it. B. Rinse the catheter tubing. C. Report to the nurse immediately. D. Add water to dilute. Answer, C. Cloudy urine suggests infection and must be reported. When providing oral care for an unconscious patient, the CNA should use A. A toothbrush with toothpaste. B. Cold water and ice. C. Mouthwash only. D. A swab with minimal fluid. Answer, D. Swabs prevent aspiration risk in unconscious patients. If a resident begins to fall while walking with a CNA, the CNA should A. Try to hold the resident upright completely. B. Gently guide them to the floor. C. Step away quickly to avoid injury. D. Lift them back up instantly. Answer, B. Safely guiding to the floor prevents injury to both. Standard precautions require CNAs to treat A. All body fluids as potentially infectious. B. Only visible blood as dangerous. C. Urine as harmless. D. Sweat as high risk. Answer: A. Universal precautions assume all fluids are infectious. The best way to communicate with a hearing-impaired resident is to A. Shout loudly into their ear. B. Speak slowly, facing the resident. C. Talk while walking away. D. Avoid using gestures. Answer: B. Clear, slow speech and visual cues aid understanding. When assisting a resident to ambulate with a gait belt, the CNA should hold the belt A. From the back and side. B. Only from the front. C. By pulling upward sharply. D. Around the resident's arms. Answer: A. Holding from the back and side allows better control and support. A resident complains of chest pain. The CNA's first action is to A. Offer water. B. Call the nurse immediately. C. Provide a back massage. D. Record it in the chart later. Answer: B. Chest pain may indicate emergency. Nurse must be notified at once. If a resident begins choking and cannot speak, the CNA should perform A. CPR immediately. B. Mouth-to-mouth rescue breathing. C. Patting on the back only. D. Heimlich maneuver, abdominal thrusts. Answer: D. Abdominal thrusts relieve airway obstruction. A CNA notices another staff member not washing hands before patient contact. The best response is to A. Ignore it since they are experienced. B. Politely remind them about hand hygiene. C. Report immediately without speaking to them. D. Do nothing unless infection occurs. Answer: B. Professional, respectful reminders promote infection control. Before taking a resident's blood pressure, the CNA should A. Ask if the resident exercised recently. B. Take the reading over clothing. C. Inflate the cuff without closing the valve. D. Ensure the arm is supported at heart level. Answer: D. Proper positioning ensures accurate readings.